Hello everyone, I'm Dr. Lim Chin Tat. I'm a private orthopedic surgeon as well as the medical director for the orthopedic practice and surgery. Thank you once again for tuning into this channel. I'm going to share with you some features of meniscus injuries in the Zoom webinar talk. Meniscus is a very important structure in the knee. It serves as a cushion between the thigh bone as well as the calf bone. It acts to absorb the stress in the knee every time we step, every time we jump. It's also one of the most common cause of knee pain. If you are interested, please feel free to check out my talk on knee pain. In my Zoom webinar, I'll go through with you the risk factor for meniscus injury, the signs and symptoms of meniscus injury, and the treatment of meniscus injuries. If you have any questions or queries, please feel free to write them in the comment section below, and I will do my very best to answer them. Thank you.
So meniscus is the cushion between the two bones. This time around, the guys have it worse. The guys have 3 times more meniscus tear than the female. And once you have a tear, there will always be an increased risk of arthritis. In other words, arthritis is actually a degenerative condition where your knees sustain a lot of damage and they get wear and tear and it's actually an old age disease. Okay, but if you have a meniscus tear, if one has a meniscus, they always get higher risk. So this is a scope picture of my patient. So this is a meniscus. This is a normal, nice, intact meniscus. Between a thigh bone is a thigh bone and a calf bone. So imagine when you walk, this meniscus plays an important role as a cushion. They absorb quite a fair bit of the pressure when you walk or run. And this is a patient with a meniscus tear. Okay, it's bleeding as well. So a different type of tear, we divide it into whether they are good vascular supply, whether the location of the tear, the appearance, and the orientation. Okay. But it's not important, but let me show you a video of a meniscus tear. This is a very bad meniscus tear. So you can imagine this meniscus popping in and out. So on top is the thigh bone, below is the calf bone. So this patient has a meniscus tear at the back of the meniscus, and this meniscus has been popping in and out. You can see, I push it back, it come out. I push it back, it come out. So this causes locking. So one of the very classic symptoms of a bad meniscus tear is locking, where your knee cannot straighten, and this is the reason. Because when you straighten the knee, the meniscus that's supposed to be at the back of the knee comes to the front and block the front of the knee. And that's why you cannot straighten. You see, when I try to move the knee, it pops out again. You see that? When I try to move the knee, it pops out again. So for this type of patient, I mean, a surgery is really like a semi-emergency. Normally, we will send and get it sorted out. It's a twisting knee injury, sudden change in direction, and then they normally develop swelling. So this knee swelling is very different from the swelling in the ligament, in the anterior cruciate ligament injury. This swelling develops very slowly over several hours. But if you have a ligament tear, the swelling develops almost immediately because the ligament has very good blood supply. And when you tear it, it bleeds immediately, and the swelling will be very obvious. Like I said, you get clicking or locking sensation. See, the meniscus has come to the front of the knee, from the back to the front, and now it blocks. It's a mechanical block. So no matter what, it's very difficult to unblock it without doing a surgery. We'll examine for knee swelling. We look for pain. We have some special tests as well, and we also look for locking. So this again, this MRI scan. X-ray has very, very little yield for looking at the meniscus. You can see there's a tear over here. So this is a thigh bone, the calf bone, and you can see one line going through the meniscus. This white line is the meniscus tear. So when do we actually do surgery? So when they have locking, I think it's an easy decision. We should do surgery. When they fail conservative treatment, we give them medicine, we give them painkiller, we send them for physiotherapy, and they still persist, still have pain, and then we will do surgery. Young patient with acute tear. So if they present to me early and I do the scan, I tend to push for surgery because I want to salvage the meniscus. Because the earlier you do the surgery, the higher the chance that you can repair the meniscus. So there's a few forms of treatment which I should go through. So for younger patients, we always try to preserve the meniscus instead of removing it, because the meniscus, the more meniscus you have, the more cushion you preserve, the more shock they get absorbed, of course, and then the lower the complication, the lower the risk of arthritis after that. So we can do a partial meniscectomy, which is to trim away a little bit of the meniscus, or we can do a total meniscectomy. So in a very bad tear, we may have to remove the whole meniscus, and that is really, really very bad news for the patient when they wake up. I'm always fear this scenario, especially the young patient, because we really, really do not want to go to total meniscectomy. We remove the whole meniscus. show you a picture. So this is the meniscus there, which I showed you earlier. So this is what I did for the patient. So do remember that this is really, really small. This meniscus is barely 11 mm. Okay, and we are having a nice view because it's all magnified, because it's all by keyhole surgery. So I'll put in my punch. I'll punch a little bit at a time, a little bit, 1 mm at a time, to preserve as much as possible. So I will punch it off, then I will take a look, I'll punch it off, I will take a look and see whether I need to go further. So it looks pretty stable, and then I will stop. And then I'll let the remaining meniscus heal and do its work. So that is how we treat a meniscus tear that causes problem. So we actually trim it and make it a round so it doesn't irritate the joint when you straighten and bend. We can do a repair. This is the patient where you see the video, the meniscus popping to the front and the back, the front and the back. It's such a big tear. If I cut it away, it'll be a disaster for the patient. So I repair it using a suture. So I repair it to the back, and it's very stable after that. And again, you have to do physiotherapy after that. Most of the time after repair, we ask the patient not to step on it for at least 6 weeks to protect the repair.